Um, hey, so it's Shakira with a session presented by LegaSE and Dr. Tynes with Vivid Recovery, and she specializes in herbal medicine and acupuncture. So the topic of this session is depression and anxiety. So in this session, we'll be talking a little bit and hoping that you'll gain some education on the topic of depression and anxiety, become aware of some of the common thought patterns and their effects on the body as well, some causes, and also some treatments, including some acupuncture and some helpful hints. So we just want to empower you all to make healthy decisions or be more conscious with the decisions that you make regarding your health, and also knowing the mind and body connection. Okay, so we'll get right into it here, and we're going to be talking about depression. Okay, so what is depression? So when you think of depression, what comes to mind? Is it like a hopelessness? Sometimes it can be looked as like a sadness or a hopelessness, but there's also different stages of depression. So depression is like pessimism and apathy, and they're all associated with low levels of serotonin and dopamine. And those are all good feel good neurotransmitters in the brain. So like when you have like a low mood, that's linked to poor sleep and fatigue and sexual dysfunction, because your body isn't making that feel good transmitter. You're not happy. Okay, so keep in mind that serotonin, it's present in the blood, and that constricts the blood vessels and acts as a neurotransmitter. So the body needs to have a pH of about 7.4 to stay in balance. So not too acidic, not too alkaline. You know, you want to have a little balance. So when you fall below that in an acidic state, that's when you have your disease, and you start having physical ailments show up and things, problems like that. So again, with the depression and the lack of serotonin, what was beautiful may be become ugly or flat. The depressed person may believe that their loved ones or their own children are better off without them, so they'll have like those suicidal thoughts. Um, and also like anxiety, going into a little bit into anxiety. Anxiety is a feeling of nervousness. So you're nervous, you're worried about the future. Pretty much it's thoughts about being worried about the future. Um, so you may like when you're giving a presentation, you may be nervous that you're going in front of this big crowd. You're nervous, you're shaking, your palms are sweating, your stomach is going. So these thoughts, they become physical acts. So again, it's like a fear of the future, being nervous of the future.
That for herbs and for acupuncture, the way in which they work are the same, and that is, in theory, it looks at these mental disorders as stemming from one or more of the five organs in the abdomen, and or a disbalance between one or more of these five organs. And that would be the heart, all physical. Heart, liver, kidney, spleen, and pancreas kind of go hand in hand. And the lungs and also the kidneys. It can be different organ combinations. And all right, so yeah, it can, depending on what organ imbalance it is, it will present itself with symptoms differently. So classic depression, which is that feeling of hopelessness and feeling lost and not having really a will, it involves mostly the liver and the kidneys, but to some extent the heart too. In theory, every emotion involves the heart, as you might expect. And so anyway, by treating those disbalances between the organs, that emotion gets better. So it just looks at it as, okay, the body's currently out of balance. So it's going a little haywire to the left or to the right. And we need to flow, but not so sharply to either side, because then that's unhealthy and it can lead to disease, or it can lead to suicidal thoughts, which is also a problem. And that is the gist. Lungs are mostly associated with sadness. Okay. But when we get into depression, it's more, it steers from the lungs into the liver and into the kidney. Lungs is more like I would say, early stage. Okay. And then when you go to like the more advanced, or they've been dwelling in this emotion for a long time, or this state of being, then it goes into those other organs. But that's a good question. Maybe I didn't specify that depression is not, by the time somebody reaches depression, they have already gone through some time in the other emotional states. So it usually starts off with either sadness. This is one of the, progressive lines. It starts off with sadness, and if sadness goes unchecked, or if it's unresolved, then that sadness grows into anger. If that anger goes unchecked and it's not resolved, then that anger then depresses. That's why it's called depression. So anger is looked at as fire going up and explosive. And when it's that fire that's depressing, and that person goes from feeling heat in the head and in the chest and in the hands to feeling sunken physically, just a heavy weight on their shoulders, on their legs, not wanting to move, wanting to sleep, all of that. And I think what would be important to know, because most people might be in one of those stages of early stage depression. So if they can tackle those early emotions right where they are now, they could possibly avoid that feeling of depression, or that state rather.
I guess some type of depressive thoughts that she may have. You may have thoughts that like you're not good enough, or you're incompetent, like you're worthless, or you don't deserve something. So again, it's focusing on the negatives. You may have fears that something could go wrong. So you may get caught up in your head, like something could go so wrong, and you're looking at all the possible what ifs, and you're trying to prepare yourself for like the possible outcome. And it may be that you're tiring yourself out mentally as well as physically. you may have fears that like you're going to offend someone, so you may not voice your opinions because you're afraid that you may offend someone, or you may have fears that you're going to forget to do something important. I mean, some of these thoughts are warranted, like if you forget to, you may have a thought of if you remember to turn off the coffee pot. That's, and sometimes you have rabbit hole thoughts that's like, um, again, you may have a lot of thoughts of fear that you're not in control or being in control of what's happening in the future, and that can be a little bit more of anxiety too. So if you're worrying every day, worrying about something that's going to happen, or if it happened recently, how is something going to happen, you may have thoughts of that one. There's also like some fears of anxiety, or I'm sorry, fears of abandonment. So you may be self-seeking, or acting in self-seeking ways, and looking for excessive reassurance. Just those are just some of the behaviors when you're having fears of like. Another thought process that may be that may cause some depression is like perfection. When you're trying to focus on getting things perfect, the way that they should be, how you think they should look, you're always chasing something, and then when it's not as perfect as you want, it can get you down. So sometimes we have to remember that we're all just human, and you're doing the best you can. But when you have those perfection thoughts, again, sometimes they can lead to depression.
I do have something to add to that, what you were just mentioning about that need for perfectionism.
Mm-hmm.
Personality disorders can contribute to feelings of depression, and that adds another kind of complicating layer to understanding and treating it. Currently, according to Western medicine, there is no cure or treatment for personality disorders, but in the larger scope of medical practice, there is some option that they can take that does include acupuncture. But in terms of depression, yeah, there are people with conditions out there that can very easily tend toward frustration in themselves or those people that they're around, just based on how they're processing things internally and from their kind of skewed perception of their personality disorder. So like narcissism is one of these things. There's the borderline personality disorder is another one. These people tend toward anger, and if the anger goes unchecked, it eventually does lead into depression.
Some possible causes could be like repetitive thoughts or like rumination. So if you're suffering from depression, sometimes you can get caught in a single or a bunch of intrusive thoughts, and it's just you keep thinking about it and it keeps going around and around, but you're not actually finding a solution for that thought. So if it's still on your mind, it keeps popping up, you want to find like a solution for those thoughts instead of letting it ruminate and just continue to whirl around in your brain. So again, like when a person is facing a problem, the right way to go about it is to solve it or overcome it. So instead of saying, I'm afraid this person may leave me, and you're looking for possible ways or that the person may show that they're leaving you, you want to, again, resolve that thought. Like you were saying, it could be personality factors. Sometimes people worry a lot, or they have low self-esteem or perfectionist and sensitive to criticism. So those personality factors and personal factors can lead to depression and anxiety as well. Again, drug use or alcohol. Sometimes you'll see smokers that have depression, or people that are depressed become smokers. Again, it goes hand in hand. So it can lead to and result from depression. There's a lot of other causes that may result from depression or cause depression. So like abuse, past physical, sexual, emotional abuse, and you're dealing with the depression in a later life, or later on in your life, I'm sorry. There's also certain medications that have side effects of depression. Sometimes there's conflict. So if you're someone who has the vulnerability to develop depression, it may be from personal conflicts or disputes that you have with family members or friends. It can be from a lost one, a loved one that you lost, or a death in the family. It could be genetics. So like your family history of depression may increase the risk as well. Probably many different genes, and they exert those effects of depression. It could also be a lot of major events. So starting a new job, graduating, you may be getting married. Sometimes these can lead to depression as well, or even a serious illness. You're sad about your health or something like that. Those can also lead to depression. I know poor sleep habits. So if you're having low serotonin in the body, sometimes that can affect the way you're sleeping. And if you're not sleeping, you're going to have poor sleep habits. You're going to have those problems with memory. So it's like a kind of like a ripple effect as well. Sometimes even staying on the internet too long can cause depression. So if you're on Facebook, Instagram all the time, and you're comparing yourself to these models, you're comparing yourself to all these people that have the perfect body, they have the perfect makeup, sometimes you can get down about yourself and forget, that we have to love ourselves as we are. That can sometimes cause depression, and sometimes you just have to detox from social media as well. Also, sometimes it could be what's in your diet.
All those are true, yeah.
Some common causes of anxiety are panic disorders, phobic disorders, stress, so stress at work, at school, in a personal relationship, financial stress, stress from an emotional trauma, stress from a medical illness. It could be a side effect of medication, or also it could be because of drug usage.
I had some notes here on cause to add to what you were saying in terms of these would be external causes. So, with depression, there's internal, external, and then a little bit of both. But some of these would be when your internal expectations aren't meeting the external reality that you have around you. That can lead to frustration, anger, and then eventually depression. Abandonment. So it could be abandonment by a family member, spouse, or child. Feeling, or even just a loss of a loved one. Either of those weigh pretty heavily on the heart. And then another one is not meeting goals. Either you not meeting your personal goals, or either with a job or with a relationship, or any area in life, not meeting goals can definitely contribute to that as well. What I do personally when I treat mental conditions, or really any condition, I put this under the same umbrella because it is psychosomatic. Whatever is going on up here affects the organs, and vice versa. Whatever's going on in the organs will go back up and affect what's going on in the head. And it can either be a destructive cycle or a good one, or a positive cycle. So that really depends on the person. And this is why thoughts and mindfulness matters so much in healing. What I always do is I start out with palpating the belly with my hands, and I find points of pain, tightness, any kind of a feeling that feels anything out of the healthy feeling. And then I clear them using acupuncture. And in that same visit, the patient can right away notice physical changes. So usually it's pain right under the liver, or pain around the belly button or below. That's where it usually starts out. And some people have, because it's been, especially if it started out from sadness, they would have some pain here along the chest as well. And some people have chest pain even without palpating as a symptom. And then we do also have treatments that we put needles in the ear, and those are effective because all of the cranial nerves traverse through the ear. So distance-wise, the signal doesn't have to travel very far. Not as far as when they're distal points like on the hands or on the feet. The ear is a lot faster of a signal. And usually during the course of treatment, they would probably be there the needles would be retained for about 20 to 30 minutes. And usually it is a once a week treatment. Patients often report feeling relaxed, not in the way that they were hyper before, but like their emotions are relaxed. They're not pulled, they don't have that feeling of being pulled down or being stretched out or like there's like a fog in front of them. They feel clearer and kind of less burdened by whatever it was that was emotionally bothering them when they came in.
Okay.
And things like secondary symptoms that are affected by depression, as you said earlier, like sleep, like appetite, like energy levels, all of these secondary symptoms also improve.
That's awesome.
Yeah. In terms of treatment, it can take multiple treatments, 4 to 8, it depends. But then along with treatment, we do tend to recommend counseling and some lifestyle coaching because it can be an external factor that's imposing on what's going on them internally and making that worse. So it may have to deal with certain measures of them changing some things in their lives along with getting treatment. But there are also cases where people are depressed and they cannot give you a clear answer as why. They don't know why. And those are the cases where you could tell that acupuncture is working for them, or herbs, or both. Most people are not in that category. Most people have both external causes with internal causes together to some degree. And that makes it more complicated and a little bit more challenging to treat in general. That's the spiel in a nutshell, if you have any questions.
I know some other treatments that don't include acupuncture, maybe like meditating and journaling your thoughts will help reduce your anxiety and depression. Or as soon as you get those depressive thoughts, go outside in nature, like move your body, start dancing, just to shake those thoughts off. Again, and also instead of trying to divert your attention, so like I don't want to think about that because that one thought that you're trying not to think.
So like when you're trying to be like, oh, okay, I won't think about this. I'm just not going to think about this thought, and I'll be okay. It's like the way we are, it's like I'm going to keep reminding you of this thought, and it's going to just keep getting bigger and bigger.
And writing them down also will help as well.
Yeah, that is a really important part.
Trying to stop your negative thoughts in their tracks.
Yeah, that's a really important aspect in healing, because if it keeps coming up, the body is telling you, hey, you have to look at this so it can get better. And if you keep ignoring it, I'm just going to keep bringing it up. It's just like a flesh wound. Well, we give those attention to heal, but we don't give attention to the wounds inside. And it's just like, okay, there's pain there for a reason. I have to heal it. And that's why the meditation thing works very well, or sitting with it a while. If we just sit in quiet and give that pain attention for a good 5 minutes, it can start to give us information or repressed memories that were the cause of why you have a problem with, say, every time somebody looks at you funny. Oh, you eventually remember, okay, when I was 5, this happened. And working through that will help you in your future experiences. So when you have those exchanges with people, it's not going to affect you in the same way it affected you since that first trauma happened.